My name is Dr. Jeff Blank, and we're going to be demonstrating a preliminary impression technique. Hollie Bryant, my chairside assistant here at the Carolina Smile Center and a clinical instructor in New Millennium Education, is going to be demonstrating a technique that we find to be very useful. First thing we begin with is the Optra Gate by Aquacell XLV. Obviously, this is a retracting device that can be used, solo, and often we have our assistants taking impressions for us by themselves without any assistance. So this just more or less is flexed in a C shape, placed in the left vestibule and then kind of flexed into the right vestibule, and then there's retractors that go up underneath the lips and kind of keep everything nice and clear, and you can see that works well. Impression trays, this is the 3M impression tray. It has self-adhesive, you don't have to paint it. We really like it. You'll see some of the features here. This is Cusamano Phase by Dentsply Caulk. We really like that as being the body material that we use for our preliminary impressions. We like its viscosity and the way it flows. Obviously, you can see it's got a good creamy texture to it. And again, an excellent material to use for preliminary impressions. What Hollie likes to do to get more anatomic detail is to actually take the Aquacell XLV, which is their low viscosity material, and syringe it right along the top. A little different than a crown and bridge impression where you inject it directly on the teeth. This is just a simplified way for assistants to try to get some of this low viscosity material to flow actually between the teeth in the interproximal areas to give us a more diagnostic cast. Obviously, this thing is seated and brought to place, and you can see the nice little technique here where you get it in place and then remove the Optra Gate and then have the patient just tip their head forward. So obviously we're trying not to gag our patient. And of course our goal is to keep our patient comfortable. Just tip them forward and allow this to sit 4 to 6 minutes, about 4 minutes in the mouth. When removing it, a little blow from the back actually just creates some pressure in the mouth, break that palatal seal, and it's a gentle rocking. Once we get this thing out, I like the 3M tray because we actually see some the frenum being recorded, and we certainly want to assess and make sure that we don't have any bubbles or blebs anywhere on the teeth that we're working on, or even the posterior stops. So as you see, great impression, good anatomic detail even between the teeth, which is why we use that wash. So in summary, Optra Gate by Aquacell XLV, Aquacell Monophase, Aquacell XLV, and the 3M impression tray.